Hi, guys. Thank you for coming back for another episode of Personal Trainers Who Care. I'm here today with Dr. Valerie Lamarre. So she's a chiropractor at the Movement Co. She's got a long history of working with people in motor vehicle accidents. Currently, most of her work involves work with endurance athletes like cyclists and triathletes. I'll let her sort of give her own introduction and talk about everything that she does, but I'm super excited to have her on today. We do a lot of collaborative work with her at Freeform Fitness in the Glebe, and yeah, I just want you guys to learn more about what she does.
Awesome.
Yeah. Thanks for coming out.
Oh, it's my pleasure. I'm very excited.
Yay. So I want to hand it off to Val and let her talk about, what brought you into chiropractic in the first place, and then what brought you to the Movement Co. specifically.
Okay, cool. So I did my undergrad in human kinetics.
Okay.
My goal was ultimately to get into medicine. What I really wanted to do was either sports med or pediatrics, very different fields. But medicine being a very competitive field, my GPA in my first year was literally just a couple points below, which meant that I could still do it, but I would probably have to wait a really long time before I got in. And I decided I didn't want to do that.
For med school, you mean?
For med school.
Yeah.
So what I decided to do instead is I just finished my degree. I just coasted. I really had no idea that I would end up here. I took an internship in my last year that I had to do. A little bit of back and forth between me and the internship coordinator. She, for some reason, wanted to put me in teaching. I was like, I'm not a teacher. I know I like those classes, but I'm not a teacher.
Okay.
School's not for me. I've known that since first grade, so.
Really?
Yeah.
Which is crazy to think that you wanted to go to med school. School's
I
not
was
for
like,
me.
I'm not going to be a teacher. I'm going to go do something else. Which is fine. I love my teachers, by the way.
Oh, you meant school's not for me as in the
School.
environment, like
The environment.
school. Okay,
School.
sorry. My bad. That's so
as in,
funny,
like
though.
teaching
Okay.
class.
Yeah, gotcha.
That's okay. So what I did was, after sitting down with the coordinator, she put me in this very big practice down in Train Yards, where I got to work with a bunch of different people. So there was a medical practice there. There was a chronic pain practice there. And at the time, before it got bought out, they were doing very much general population, like 18 to like 80. Yes, we saw motor vehicle accidents, but other things.
Okay.
That's where I got introduced to the profession. One of the chiros that ended up taking over kind of took me under her wing. So I would go and I would observe and I would do my work as the kin student. But every patient that walked in with a very similar injury, I'm going to pick shoulder for no reason at all, the person who was working with that chiropractor specifically would get better 6 weeks faster than when they were working with the physiotherapist that was working there,
Okay.
by observation alone. And I was like, what's different? I'm a very curious human being by nature, so I was like, something's different here. And then one day, and I'm allowed to tell the story, my sister had this funky nerve stuff going on, numbness in the hands, and I told her, maybe you should come and see someone at the clinic. So the chiro ended up seeing her, and she's like, well, she's your sister. If she's open to it, you can come into the office for the first session. And I said, yeah, let's do it. So we walked in, and she starts doing all this assessment stuff. And I'm like, this is so cool. Found her problem, was able to treat it. Numbness goes away. And I decide that's what I'm going to do for my career. I'm going to go do that. I had no idea. So I'm about 4 months out. I got all my referrals. I got all my letters. I applied to the school down in New York, the only school I applied to. And then I left. Side story, my mother was terrified of chiropractors at the time because she'd had a horrible experience.
No.
Like a horrible experience.
Yeah.
And so she was really scared. So when I told her I'm going to go be a chiropractor, she sent me an email with 40 different career options to choose from to do with my kin degree. So I had to bring her to my interview so she could see the school and ask questions and stuff. And then the rest was history. And by the way, she sees one now.
She sees one
chiro
now. Okay, so she's like converted.
Yeah, she's converted back.
That's good. And then, so you started at a clinic, I'm assuming, outside of school, or you went straight to the Movement Co.? Like, what was your path there?
So my path was going back to that Train Yards clinic. Now, by the time I went back, because she was my mentor, she was like, hey, I have a job. You want to come? And I said, yeah, absolutely. Still love working with her to this day. But somebody had changed ownership. And so the process had become very different. They were seeing a lot more motor vehicle accidents and WSIB patients, and I enjoyed working with it. My challenge became all the bureaucracy around it.
Yeah.
And so I'm a fighter. I will go to bat for my patients all the time. I'll write letters if you need letters of support. Like, I will support you. That's my job. And at this point, I was always arguing with people like, they need more care. Nope, that's it. They're done. They need more care. No, that's it. They're done. It was like, I can't do it anymore.
Like
So,
patients were being
patients,
graduated
yeah.
and you felt like it was like they
It
still
wasn't
needed
time.
more time. Yeah.
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 They weren't being graduated by me. They were being graduated by the program they were going through. So that to me was really frustrating. So when COVID happened, they kind of let me go there. And then when they called me back, I was like, I don't want to go back.
Yeah.
So that was a little bit of soul searching. I actually didn't find the movement co right away. So at that point, I was like, maybe I'll use my degree to transition to something else.
Yeah.
Because I really couldn't find my niche. I couldn't find my space. Just the way that I practiced didn't seem to mesh in other clinics, or the way that I wanted to anyway. And then in 2021, a friend I had worked at in one of the first practices I was in told me that Dr. Luke was hiring at the Movement Co. And she's like, send your resume. And I'm like, yeah, I sent it. I haven't heard back. So she grabbed my resume and dropped it off in person. And then I got a call.
Amazing.
And the reason why I wanted to work with him was because he did what I've always wanted to do. I want to go to the Olympics and work with Olympic athletes. It's been a goal of mine. It's a bucket list of mine. And I'm going to get there. I just don't know how.
Yeah.
He had done it, though. He was working with Cycling Canada at the time. And so when I walked in and he asked me, he's like, what do you want to do? And I'm like, I want to do what you did. And I don't know if that's what sold me on it. Just because I was brutally honest. And I was like, that's
You mean
something
that's what
Yeah.
sold
Then he
yeah,
was
him
like-
on you? Yeah.
I was like, oh, yeah. He's like, you know what? Yeah, I like that. But either way, the rest is history. And I couldn't be happier about where I am working and who I'm working with. So
Yeah.
that was very exciting. That's how I ended up there.
Yeah. So how would you describe the Movement Co. and like the approach that you guys take with patients compared to what you've seen in other places? Or like at least the philosophy that you guys embrace.
So we embrace the integrative health model. I know a lot of practices do this in a way. But my experience has been, and again, everybody is different, that most of the time, even though you're working with other disciplines, you're still kind of siloed. Sometimes you'll share a case, but it's kind of like, oh, I don't know what I'm doing with this case anymore. Can you look at it? At the Movement Co., when we draw up our plans of care, what we do is we actually pre-integrate the people that we know we need, so whether it's the physiotherapists or the massage therapists, into the plan for our patients. Because what we do is we use everybody's skill set to the maximum. So I like to think about it literally like a bicycle wheel. The patient is the center, and you've got the spokes, right, which are the different practitioners, and we complete the ring. I feel like in a lot of thank you. I feel like in a lot of settings we had the spokes, but the ring was never complete.
Yeah.
And so in our practice, regardless of if you're working with a practitioner or not, the practitioner can consult on it. So I have some patients that they start with me and then they continue their care in physiotherapy and they're like, oh, I'm not working with you. I'm like, I'm still here. I'm still present. And they will still ask for my guidance if there's an exercise they're not sure if it's going to work. And they do the same for me. And I think that's what's different. And that's what I love about our practice.
Yeah. Extremely integrative.
Extremely integrative. And
Yeah.
communication is key.
It reminds me of when we were talking about the direction we were going to take with this podcast. And that quote that I saw a couple weeks ago about how like every practitioner is working in each other's backyard, but then not talking about it.
Yeah.
And that happens all the time in healthcare. Like people are making decisions that might affect another system of the body or might not take into account another system of the body and how the nervous system might react, how anything might react, right? So it's refreshing to hear that, especially now and especially in Canada where things are
It's a little chaotic.
we're so beholden to bureaucracy and to the system that it makes it hard to communicate.
Absolutely.
Yeah.
I think what's happening is because that ring isn't complete, we're relying on the patient to pass along information.
Yes.
And sometimes they don't necessarily understand, or the parts that
they don't have the
find-
language. Yeah.
or the parts they find important. They're not that they're not important. They're
Yeah.
important, but the practitioner needs one more piece that is perhaps not well understood. And then all of a sudden there's miscommunication, and then you have one practitioner like do this exercise, and then the other one counteracts it, being like, no, do this one, no, do this one. Now you have a confused person who doesn't know what to do, and when you have that, they don't do anything at all.
Yeah. And the same, that also goes for like what we do. And like, you know, we've had a couple clients that we've shared, and every time I felt so much better having that direct communication, being like, hey, just make sure that like Val's okay with this. Or like ask her
Yeah,
what she thinks about this part of the program and whatnot, right? So it's like you need to have a trainer who's like curious enough and humble enough to ask those questions, and then also vice versa. Like, because we see clients way more often than a lot of rehab professionals do. So we might know something that you guys don't, and you guys might see something that we don't. And it's so important to have that conversation, especially if you're coming from different avenues or different perspectives.
Absolutely. And that's why I
Yeah.
tell my patients, like, if people are open to it, we can create a line of dialogue between the different professions. As long as you give us your written consent to do so. Of course, there's some information that we won't share, but anything that's regarding
Yeah.
your exercise plan, as long as you're open to it, I think that's okay and safe
Yeah.
to do. But I think this is where, just as a practitioner, there's a lot of unknowns as to what's okay and what's not okay because the language is a little confusing.
Yeah.
But at the end of the day, it's the patient's care, so they're in charge of it.
100%. What would you say are the biggest complaints that people come into the clinic with? I know that like you guys have your athlete population and like a lot of cyclists
Yeah.
go to you guys, and then you guys have the other side of it where it's like Gen Pop. Like, what are the complaints that you're seeing day to day?
So I'll say most of our population, minus the cyclists and triathletes, are definitely active population. So a little less general, much more on the active side. In my line of work, although I'm a chiropractor and most people think I only treat the spine, I'm actually the foot person in the clinic. I'm the person who deals a lot with the foot aspect of foot contacts for runners and for cyclists, for a lot of the general population. I would say more often than not, we see a lot of like maybe lower extremities, so hips and down. But because we're triathletes, then we'll see a ton of shoulders too. So
Yeah.
we get a lot of spine stuff. Everything is connected, of course.
Yeah.
But I will say that in my practice, I probably see a lot more stuff that's like pelvis in all the way down to the feet recently, and most in the summertime. In the winter, then you'll see a little bit more back and stuff. It does change a little bit seasonally, which is really interesting.
For sure.
Yeah.
Okay, that's fascinating. But I didn't know about the foot thing. So can you go
Yeah.
a little bit more into that and like what that entails? How you even begin to address that? Like, are you massaging feet? Are you giving people techniques? Like, what are you doing?
So one of the things that I think is very confusing out there is the fact that the foot is super complex and it's our base of support. So if you're a runner or a cyclist, you need to use your feet regardless. You're not doing any of that on your hands. I mean, you can, probably. There's probably somebody out there with it, but most likely you're using your feet.
Yeah.
And so this is where we can start to see dysfunction. So people don't know how to pronate properly. They don't know how to supinate properly. Then there's the contradictions with the shoes. Do I go barefoot? Do I have a lot of cushion? Do I not? And so
Yes.
it's all individual to the person. But because of the fact that I had a really bad case, one of my patients of plantar fasciitis that I thought I understood really well, and we had it managed, and all of a sudden it flared up, and it was like, why is it flaring up? I took a deep dive in terms of like foot contacts and foot approach and how it affects the chain going up. And sometimes it's reverse. Sometimes it's something at the hip that then changes the way you're going to
Yes.
foot contact.
Yeah.
But because I spent so much time learning about it and learning exercise programming in and around it and what people's feet should be looking at, I kind of developed my own sort of expertise on it. And I'm always studying it and how it like works its way up.
Wow.
But yeah, there'll be like some soft tissue treatment and that kind of stuff. The foot is complex. There's like 13 bones, 100 ligaments, and all sorts of tissues and tendons in there. But most of the time it's confined to a shoe and nobody looks at it.
Yes. How are you, like, are you looking at the foot? If someone comes in with a foot issue
Yep.
or some other issue and you're like, okay, are you going to look at the foot first or,
First thing I do is usually a movement screen
okay,
when they're doing it barefoot. So yeah, I'm looking at the foot and seeing how the rest of their body moves.
you see how they walk,
Yep.
you're seeing how they
Seeing how they walk,
lunge,
how they lunge, how they squat, how they do single leg balance, how they toe raise, seeing if they're able to lift their big toe and if there's any tibial rotation that's happening or not. So all these kind of fun things that are super interesting to me For most
It's
people are like, I don't know
fascinating.
what's happening. And I'm like,
Yeah,
it's
for
okay.
sure.
Try this. And then next thing you know, like, oh, it doesn't hurt. Right?
Uh-huh. So finding what dysfunctional movement patterns that they've built up over time
Yeah.
that are impacting the soft tissues that are causing pain.
Yeah, exactly.
Are you looking at the spine specifically, like feeling around the vertebrae? Like, how does that work? Like,
If I need to, yes.
okay.
Okay, so if we're getting into spine kind of techniques and stuff when there's a spinal injury, you want to make sure to do a lot of tests. You want to rule out any type of nervous problem, right? Like discs, those kinds of things.
Like a herniation you're
Yeah.
talking about
Yeah.
or something? Okay.
Especially if there's like foot and stuff, you know, going on, you still want to go back and look at the spine and be like, oh, is this caused because you have a mechanical problem at the foot, or is it caused because we have a nerve problem in the low back? Right? You want to make sure
There's
you
some
rule
sort
it
of
out.
compression that's
Absolutely.
leaking its way down.
Yeah.
Yeah. Okay.
Because that's a thing. So
Yeah.
you have to rule that out. When it comes to the spine, we have orthopedic tests that we usually do, making sure that things are okay. You want to do your kind of motor control stuff to make sure, like, hey, okay, the nervous system is healthy. Rule out all sorts of red flags, right? Making sure that they're in the right office at the right time and that they don't need to
Okay.
go to emergency. Like somebody who can't pick up their foot at all, and they're tripping on it, or they have like bowel or bladder issues. That's an emergency. That's not, they're like, yeah, so like I hurt my back and suddenly, I'm peeing all the time. Okay, we got to go to the ER. That's not in my office.
The ER.
Yes, that's would fall under something that could be damaged spinal cord.
Okay. Right. So like post injury or
Post
post
injury, they
accident.
show up, and then that
I
is
see.
happening.
Okay. Right. Which makes sense.
Yeah,
Yeah.
and that's you're like, okay, that's the wrong office. But if you're talking about how we assess the spine, you want to do your orthopedic tests, and then we'll do palpation, feeling what the joints feel like. As weird as it sounds, we can feel that.
For sure, yeah. But I actually find that interesting because I've worked with a lot of people who have pelvic floor concerns and core concerns. Is that a red flag that they should be looking at some sort of nerve compression in the spine beyond, like, even if they didn't have a prior injury, if they're having pelvic floor and core issues, would you consider that a red flag for the spine or some sort of disc compression?
Not necessarily. No.
Not necessarily.
Yeah, you
Okay.
got to ask the right questions.
Okay.
This typically is rather sudden. There's all sorts of other signs and symptoms that would show up as well.
Okay.
But we really do want to make sure that, like, everything in this. Usually, if somebody's coming in with that type of complaint, I'm still going to rule out any type of spine stuff. That's just being diligent.
Right,
Yeah,
for sure.
yeah.
Make sure that everything's, because things can pop up that you don't really know
Always.
are there.
The only issue, what I've found, is that sometimes people don't tell you. That's the harder part. You're like, hey, are you experiencing this? They're like, no, because they're embarrassed. And that's
Shame,
okay. I get it. But in order for us to be able to, do the best for you, we need to know these details. There's a reason we ask the question.
Yeah, 100%.
Because if not, then we could do something that we shouldn't be doing.
Yeah.
We don't know.
Yeah. You sort of have prompted like a line of thinking here. What are some red flags that people should be paying attention to, or like clues that they maybe should see a chiropractor specifically, but beyond just a physio? Because it's not just pain, right? Like
It's not just pain. Decreases in range of motion, tightness and stiffness that won't. These are not necessarily red flags. I would call them like yellow or orange flags.
okay.
Stiffness or tightness that won't go away and is kind of progressive. Things that are intermittent, come and go, and are turning constant. Like, they're in general a sign that you should kind of look into it, right? Like, you have this tightness and stiffness, and now it's achy and it's referring pain somewhere else. And I would get that checked out. I usually tell people, like, if you're feeling something that is not self-resolving within a couple of days and it's progressing, go see someone. Mm-hmm. It doesn't matter where you start. Start somewhere. Make sure you're listened to. Mm-hmm. And then seek help.
Okay.
I'm like, why would you wait? You only get one body. You get one.
True.
And I know we have replacement parts, but not for everything. Mm-hmm. And you have to take care of it.
Yeah, for sure.
Yeah.
So beyond, I guess, those traumatic injuries where you know that there could be something
Serious?
immediately wrong or serious, what are some of the more chronic things that you're seeing that are related to habits, I suppose?
Yeah. In our niche, one of the things that we see a lot is we have a lot of people that work desk jobs. Mm-hmm. And so what happens is they want to be super active, but for a good chunk of their week, they're sitting. They get up, they do 5 minutes of warm up, and then they go do their activity. And then you don't necessarily do a great cool down and end up sitting again. And so we see this chronicity of like not enough movement in the day to day and then going to be hyper performing later, which then leads to its own sub series. I can't give you necessarily perfect flags, but that increased stiffness, that sudden loss of mobility and range of motion. We see a lot of tendinopathies creep up out of stuff like that.
Oh my
too,
God, yes.
Right?
Yeah.
I'm sure you see it in the gym too.
Yeah, for sure.
And so that's typically what we see, right? Like we sit a lot and then go up and you're like, boom, I need to go do my Ironman training since we just had it here in the city,
Yes.
which is high volume, high intensity. You got to do a lot. It's a lot of load. It feels like you don't have a lot of free time, but then you spent your whole day, 8-9 hours sitting. And when you're done, what do you want to do? You want to crash on the couch,
Right.
right?
Yeah.
And so the most often thing, and the thing that I talk to about with my patients is warm up, cool down, and are you doing your strength program? Because we're dealing with endurance athletes, more often than not, the first thing to go away with them is strength.
100%. Yeah. So many people I know who've trained for these endurance events, I see them like months later in their gym and I'm like, oh my God, where have you been? And they're like, oh, well, I guess I got to build some muscle back after.
Well, that needs to stay even during your training. This is the hard education piece. I mean, like, you can't let that go. You can shrink it, yes,
for sure.
but you still need some of it.
Maintain something.
Yeah.
Yeah. Yeah. I have a friend, he does Ironmans and shout out also. He like bulks up right before and will put on as much muscle as he can and then we'll go into that endurance phase. And I think people sort of go one way or the other, where they go full bodybuilder mode or they go, which is fine, or full endurance athlete mode, and they're not really sort of dabbling in both or either, which is fine. Like, live your life, but
there's a balance that needs to be struck. And I think it's more often than not missing. And part of it is just because it's overwhelming.
it is. It's so hard.
Yeah.
It's hard to manage everything and like you don't have a social life and get your sleep and meal prep and there's so many 9 million tips all the time now that it's like, how do you keep up? But keeping your joints healthy, keeping them strong,
Mobile.
making sure that they can absorb force and produce force.
Yeah.
If you're doing something long term, if you're doing an endurance event or even just for life. I'm curious about the kinds of people who are successful versus less successful. What are you seeing in people who recover quickly, who don't come in as much as other people do?
Okay.
Out of necessity, not because they're just avoiding it.
Before I answer that, define success for me.
Okay. Recovering quicker.
Okay. So number one,
Less flaring symptoms.
people who commit to their plan of care. And number two, people who are diligent with their exercises when we tell them to be. Mm-hmm. If they're doing those things, they're going to do great. And what I mean by exercises, if I gave you 12, you're not necessarily doing all 12. I want you to. That's the ideal. But that you're not just all or nothing. And so I tell my patients this all the time. If you have a series of exercises and you have a busy day and for some reason everything went nuts on you that day and going to do that series feels overwhelming, but you could do 2. Just 2.
Yeah.
That is already success. Because just doing those 2, because they're a part of your plan, they're a part of getting you better, are already going to make a difference.
Yeah.
And for the patients out there who think we can't tell that you don't do your exercises, we can tell.
Oh, 100%.
Every time if you're not doing them because we're not seeing the results that we want to see.
Oh, 100%.
Yeah.
And, I see that myself too. Like, guys, your homework.
Yeah.
And it creates an expectation where it's like, oh, I think people rely on having to go into the person's office or seeing the person and expecting it to be enough. And it's very rarely ever enough, unfortunately. Like, in the context of personal training where like, you have a specific program and a specific goal and, you're coming in and the goal is to achieve that with the sessions that you're doing, then the program and the volume of that program should reflect that. But at the same time, like there needs to be an accountability factor, especially if you have a goal that's beyond what we can offer: diet, sleep, exercise outside of it, literally just moving around. Like not sitting at the desk all day, taking movement breaks, doing other things to take control of inflammation from injury, or in general, just healthful habits that help to promote the other goals
Yeah.
that you're seeking.
I will say another thing that makes people successful in our office is when they finally, instead of being like, "Ah, it's not working," and they're trying to put it in somebody else's hands, is when they finally take that back a little bit. And they're like, "Oh no, this is mine. I can do it." And if you ask me, other than the manual therapy, which is like, yeah, sure, it's an important part, the education piece and teaching people how to do that, that's the most important part of our job.
Taking control of their own
Teaching them how
health
to
and
do
their
that.
own, yes, 100%.
Empowering them to do that.
Yeah.
That, to me, is the most important part. Because like I said, you only get one body. This is your health. This is your care. And if you have goals that go beyond, somebody else can't fix them for you, just like
No.
most things in life.
Yeah.
So it's going to be one of those things that, like, I'm going to help you along the way. I'm your buddy. And for sometimes, yeah, I'm going to be the one doing most of the heavy lifting, sure. But then I have to slowly teach you how to take that on so that you can kind of move forward, which is why I love, in like a tangent to that, graduating people into personal training. Right? I do know some of the programming, but like layering it and like building it up and doing all those things, that's not what I'm trained for. And so that's why I'm like, I don't want to be everything to one person. I want to be within my scope and what they need me for. And I'm still going to be there to like help them do maintenance, especially if you're doing high volume stuff. Like pro athletes have people in their background because they put their body through a ton of stuff. I think that you do well having somebody on your team and having like healthcare practitioners follow you through all the stuff you want to do.
Yeah.
Because I do. I mean, I see practitioners too. I do personal training. Like, that's only to my benefit and makes me better in my job, but also makes me better in the sports that I want to do. And so in that vein, like I transition people into training because I'm like, this is where you need to be right now. And we are going to check in on how things are going and how things are changing periodically after that. But the big chunk of it where now you can actually do stuff, that we're good. Now you get to go and do the next part.
Yeah, progressive.
Yeah.
And moving on to the next hurdle. It's not like, okay, here's 2 exercises that you need to do for the rest of your life. It's, no, we're going to bring this piece of your body up and then move you along to the next step. And, your body, your nervous system needs a stimulus to change. It needs a reason to change. And if you're not giving it those consistent inputs, there's no reason for it to change. You were extremely, extremely adaptable.
Yeah.
Which is great.
It's a beautiful thing.
Which is a beautiful thing, but also a tough thing because you're like, you got to hammer those nails every single day to get what you want.
And I always tell people it's also important to go back to your foundations too. Like doing that progressive stuff and then being like, okay, I'm going to go back to my basics. Because the brain is also so plastic that it can also it's also lazy. It's plastic and lazy. So basically what's going to happen is it's going to take those foundations and tweak your movements a little bit in terms of the path of least resistance. But then that can lead into a problem, right? Or a bad movement pattern. And then it can lead back into some of the stuff. So that's typically sometimes how I see injury reoccur. In some patients where it's like, oh, okay, but I've stopped doing my basics or going back to them to make sure I'm still fundamentally doing them well, to keep doing the harder stuff. If you can't do the foundations and can't do the harder stuff, where's that gap in the middle?
Yeah. You said something that like triggered me.
I have that effect on people.
There's so much debate in the fitness industry right now about like movement patterns, bad movement patterns, good movement patterns. And obviously there are less favorable strategies for doing something. Like, for example, everyone has seen videos of someone doing a deadlift where like their back is completely rounded and they are putting a lot of stress on their vertebrae, their spine. That typically can push the dial towards more injurious situations. But then there are other people on the other side of the camp who are like, no, tissues are highly adaptable. that won't necessarily hurt you. You can get stronger. Where do you sort of land in this debate? Because some people are like, complete movement optimism, no movement is bad, all movement is good, movement is medicine, as long as your body is just prepared to move in that way. And then other people are like, no, your form needs to be perfect at all times. You need to move in this specific way, and you need to hold your body in this very specific posture at all times. And I myself sort of float on either end. I think that there needs to be standards for movement. And I think that there are better strategies for movement, more efficient ways to move your body, which is like, textbook form or whatnot. But I think that when people are afraid of moving in a certain way, then that can create more pathology and more dysfunction if they're avoiding movement altogether. So I'm curious about your take on this and like what chiropractic says in general, also because of the intricacies of loading the spine.
Yeah. Okay. Loaded question. All right.
Yes.
Let's
Take it wherever you want to go.
Okay. Let's take it with the fact that I'm kind of a little bit on the board. Actually, if you looked at me doing one of our recent social media posts with a kettlebell, I have the worst absolute form possible. Don't worry, I did not get injured. I did it on purpose to show something.
Yes.
But on that spectrum, I'm kind of the same. We need guidelines and we need a particular ability to do that, but it needs to be modified for the person's anatomy and how they move, because nobody has the exact same hip form. But I'm also the same kind of in that middle ground of like, hey, we have to be able to move. More movement is better. We're more designed for that. But at the same time, if you don't have, like, I saw this guy deadlifting once. I swear to you, I almost walked into the gym, gave him my business card, because in 6 months he was going to have some type of disc issue. But it was all over the place. There was no form. It was too fast. There was zero control in his movement. And I think it came down more to that. It's not that he didn't have the range to do that movement. It's that it wasn't properly done in a controlled type of sense.
Yeah.
It could be fast or it could be slow, but it should still have some type of control. The movement shouldn't be all over the place. You shouldn't be swaying necessarily in what he was doing.
Okay.
And then it was like clearly way too much load for him, right?
Yes.
Like, I do agree that we should be moving in a variety of movements and training those patterns, because if you don't, you lose them, and then you can get injured when you try to bring them back. But you have to do it safely, and you have to build that foundation to get there.
100%.
Right?
And it's interesting because like when I'm coaching a deadlift, for example, specifically, I think it's such an emotional movement for people, and they're like, oh my God, I don't want to hurt my back. And like, I generally go towards the approach of being like, hey, you're probably going to feel it in your back. You're still learning. That's also normal too, because you want to build the strength to stabilize the movement. Most of the movement should be in your glutes and hamstrings, but you will probably feel it in your back. I don't want you to be afraid of that. And I think that also helps people feel a little bit more empowered compared to, which also helps them build strength, right? Because if they think that their form needs to be absolutely perfect 100% all of the time, they're not going to want to increase the weight, which is exactly what's going to get them stronger and get their body and their tissues adapted to lifting weights. So it's like this push and pull of being strict on form in the sense that we want to make sure that you are feeling and sensing the right things.
Yes.
But not afraid if something goes slightly awry. Because with everything that you do that's worth doing, there is a risk involved.
The harder part that I tell people is when you don't use a particular movement, you will lose it.
Yes.
That's the problem. Retraining something that like you had to decrease, like somebody who did get, let's say, back pain, like I don't want them getting rigid. It's why we don't prescribe lying on your back for 2 weeks anymore. It used to be the thing 30
Sorry,
years
what do you
ago.
mean for what?
Low back pain. And being like, you're just going to rest on your back for 2 weeks and then you'll be fine. And they come out of it. It takes so much longer to get better. It was like 30 years ago.
Yeah.
We've changed that. But I tell my patients, I'm like, yes, it might be painful. I need you to work within what's tolerable. And you'll see that as you work into it, you'll start to learn what's safe and what you can tolerate.
100%.
It's a lot easier to then bring range of motion back than if you completely stop and then it goes away.
Yes. And it's like sort of thinking about what's too much too soon and what's actually inherently bad.
Yeah.
It's hard to say, but really your tissues will be able to adapt. Your body can do so many things. It's like it's what's the saying? Like the dose makes the poison.
Yeah.
People have trained themselves to not have a peanut allergy by having the tiniest little pieces of peanut and sniffing it and licking it, and then eventually they don't have a peanut allergy anymore. And it's the same way with movement, especially post-injury. You're slowly going into ranges of motion and slowly seeing what kind of hurts, and then sort of moving back and not pushing the tissue too hard. But the tissue needs to be stressed to adapt,
Yeah.
which means challenging it over time
Yeah.
and not being afraid of that pain. So I think, and that's something super interesting and emotionally loaded specifically for chiro and spine stuff in general, because obviously you need to be super protective of your spine. So
Yeah. It does a lot.
it does a lot, which is must be like an interesting perspective for you to have, where obviously you have that chiropractic background and you strength train and you promote strength training, and you have this adaptive tissue understanding philosophy. Is there anywhere where you like draw the line with spinal stuff specifically? It's okay if you don't. But
I guess it's gonna really depend. Like if you have something that's unstable in your spine, right? Like if people have severe spinal stuff, it's going to be really dependent on how they respond to some of their basic movements. So I guess on that one, it depends on the case.
for
I
sure.
don't have a good answer for you.
Yeah, I know it's hard to answer, but in terms of like herniations, for
Yeah.
example, you have a client who's coming in and they just had a herniation. They love training, they love strength training. They don't want to stop. They're very scared to lose muscle.
Sure.
And what would you tell them? What would you say? Where would you start them? I know you're obviously doing a movement screen and an assessment and giving them exercises.
So my first step is always going to be making sure we don't have any red flags where we're like, okay, this is something more serious. It's affecting spinal cord or like deep nerve. We need to make sure we assess that first. Okay, so we clear them of red flags. Good. Then where do we start? Well, we want to start first by seeing what type of guarding they have, and then follow up with what movement can they tolerate and what can we encourage. Right. So some people, when that happens, they're flexion resistant. They can't flex because then that creates a lot of pain, or
Yes.
they can't extend. They come in with this weird antalgic lean. Step one is just trying to help that calm it down and giving them, actually, you've worked through some of this, like hook lying breathing as
Yes.
an example.
You
For
guys
those
give
at
hook lying
home-
breathing?
Oh yeah, absolutely.
Wow, I didn't know that.
It's an easy intro, calming type of exercise.
Yes.
Just gave it today. But yeah, for those at home, it's a really cool one. It's nice. It's gentle. It's easy on your back.
very
Brings back breathing and actually helps calm a lot of the symptoms that you have. But yeah, you start at the base. What can you tolerate? What do you not tolerate? And let's work within what's tolerable right now.
I love that you said breathing.
Yeah.
I love that because
Breathing is great.
it's a direct like tap into your nervous system, and when you are injured, breathing through a position can help your brain be like, hey, actually, no, it's okay
Yeah.
to be here.
But that's because your reflex is to hold your breath,
Yes.
right? You're like, it hurts. And then next thing you know, it
Yes.
hurts more.
Yes.
I'm like, breathing actually helps regulate your nervous system. Absolutely.
Yeah.
So, yeah.
I'm so glad that you brought that up on your own, because it feels just so much more powerful than me bringing it up because I'm a breathing fanatic. But it's a great segue into my next question. Like, what's the role of breathing that you see in posture, spinal
Create space.
injuries, anything?
Create space. Breath creates space. How can I describe this without getting too technical? So, breathing is the whole system thing. Not only does it bring oxygen to your cells and tissues, which they need in order to be able to do the work that they need to do, but it allows for space creation, especially in through the rib cage. It's going to allow for things to kind of relax and regulate the nervous system. So, with some of the weird things in the breathing world, at least weird for my patients, for us, it makes complete sense. But for our
Yes.
patients is when I put them in a position, I'm like, okay, now you're just going to breathe into it and it's going to make more space in through your hips. And they're like, what?
Yes.
And like,
Because they're like,
yeah.
my lungs aren't
Yeah,
in
my
my
lungs aren't in my
hips.
hips. I'm like,
Yeah.
no, but your lungs are in your rib cage, which there's a diaphragm and there's an opposing piece to said diaphragm, which is your pelvic floor. And anytime you
Yes.
breathe, you push things down, and therefore that has to be able to move properly,
Yes.
which then affects the hip range of motion.
Yes.
And so this is where we're like, oh, okay. But breath work also works at understanding your core, right? That transverse abdominis and how it contracts, and why sneezing, if you have a disc herniation, hurts so much because you're creating more
Yes.
pressure. So if you learn how to use that and strengthen that through breath, because that's why it feels like you get abs when you're laughing. You're actually using it so much,
Yes.
right?
Yeah. Contraction of the
Yeah.
diaphragm and all of your respiratory muscles. And you can't, I will always go as far to say that you cannot have true core strength without having respiratory efficiency and proficiency.
I would agree with that statement.
Yeah. Like it's the foundation to so much spinal stability. And if you can't breathe through a position, then you don't own it.
Nope.
Which is why it's like the perfect place to start for so many injuries. And it's the first place that I go if I ever have a client who's complaining of any sort of pain, because the position of the rib cage and the hips is going to affect everything else.
Yep.
Your shoulders, your arms, your elbows,
Your neck, your jaw.
your neck, your jaw. Yes, everything. So I'm so glad that you said that. And it's not an approach that I have personally seen every chiropractor take. So that is very refreshing for me to hear.
Thank you. I think it also
so happy.
depends on some of the continuing education you kind of...
It definitely does.
My very curious nature makes it that I'm always looking to learn more about how the body functions. I
Yeah.
find the human body absolutely fascinating in general. I mean, it's this absolutely beautiful, powerful... I mean, look at the things we can do with it. And yet,
Yeah.
it's so fragile
Yeah.
and delicate.
Yeah.
So I find that...
System.
Yeah, it's crazy, beautiful, and that's what I love about it.
Yeah. Yeah. And it's such a process to explore it. And the industry is so malleable. Things are changing all the time.
Too
There's
fast.
always new research. So like when you're working with someone, you are working with they currently know, with the schools that they've gone to currently know, which are 10, 20 years behind. So knowing and making sure that the people that you're working with are constantly educated and constantly curious is another huge important thing for any sort of profession, just because especially the body. Like I feel like every single week I see a new article where I'm like, my opinion about something is completely changed because I'm like, oh my God.
I think the most important
New
part
research.
is keeping your mind open to it, because
Yeah.
the thing about, I think this industry in general, although we know a lot about the human body, but like manual therapy, nutrition actually is the number one for this because it's quite young, is that the science, it's new, it's a baby, it's growing, it's evolving. And that's why things are rapidly changing,
Yes.
right?
My people are so angry on
People,
the internet
yeah,
every day.
everybody's so angry about everything. There's a new fitness thing out there.
Yeah.
I get it all the time. They come, what do you think of this exercise I saw on Instagram? And I'm like, it's great. It's not for you.
Fascinating. What do you see? What do people come in with?
Oh, all sorts of stuff. All sorts of stuff. I often get a couple of like technique related things that they see on Instagram. People love sending me those pop and crack videos. Tell me if
Okay.
they should get that.
Yes.
But then I also get, I often see the knees over toes guy and people panicking over that. They're like, my knees aren't supposed to go over my toes. I'm like,
Oh my God.
They do.
I still get clients who are
yeah,
saying that
because
when I'm
for a
doing
long
squats. It's crazy.
time, the
It's
squat
huge.
was at 90 degrees with the feet
Yeah.
like this, and it was straight down, and you weren't supposed to turn out, and you weren't supposed to turn in, and you were only supposed to turn out. And then at some point, it was like, you need to, I don't know. It's
No, I
changed
totally
so much
know what
in
you're
the
talking-
last
like-
decade alone.
All the
So-
time. It's so true. I know.
And so I tell people, I'm like, let's see what your hips do. Let's see what your feet do. And let's see what we can actually do.
Yes.
And then we can go from there.
Yeah.
But yeah.
Tell me more about the cracks. Tell me, what is an adjustment? Why do you do it? Who do you do it for? When?
Okay, so for my colleagues out there, there's a lot of varying kind of forms of chiro. in terms of philosophy and like our approach that we take. So I would be considered somebody who's more of a mixed in my world because I do a lot of manual therapy, soft tissue, muscle work, and then I would use the manipulation if I think my patient needs it to restore range of motion in the segment that I'm working on.
Okay.
Basically, all joints in the body can basically be adjusted. Weird one, but also the ears technically. Yeah, it's a pretty cool one for me. But that's why I use the adjustment. So if I'm trying to restore range of motion, that's where I bring it in for myself.
Okay.
Yeah.
Or like
Any
elbow, shoulder,
yeah,
any joint.
Sure, any joint.
Yes.
Yes. If I'm like, okay, that joint isn't moving in the directions or planes it's supposed to, patient is open and consents to it, great. We'll do the manipulation for that particular joint or joint above and below, whatever is required. And that's what I use the adjustment for.
So you might adjust
Yeah.
a part of the spine.
Yep.
Because of the nerve innervation to the joints, or because of the
Sometimes.
compression that might be happening and changing the range of motion? Like, what is actually happening on a deeper level there?
Well, if you're talking about the spine, then yeah, you can do that. You can affect the nervous system at the spinal level and see different reflexes change at that level.
On like a distal joint, like an arm or an elbow or
Yeah,
something?
I've seen that. I don't do necessarily that much in my office. I do on some patients that are open to it. Some of them are a little bit more scared of the adjustment, and I'm okay with that. Like for me,
is
it's
so
what
fair.
they're comfortable with. Like
Yeah.
I had somebody earlier this week. We're working on lower extremity. Like, are you also going to pop my neck? I'm like, I'm not popping anything that you don't
Yeah.
want me to.
Yeah.
And right now, I don't need to adjust your neck.
Yeah.
Like, unless you tell me you have a neck complaint, we actually go assess it to see if you're qualified to do that. Like, if you're good for that, I'm not going to do that randomly without you knowing. Like, I'm not doing that. And I have a lot of people that ask me that question, which scares me a little bit. But for the spine, I have seen it where specifically in kind of like certain regions, if they're getting kind of like these weird symptoms down into the arm, when you manipulate the
Like
spine,
numbness and stuff,
numbness
yeah.
and stuff, you manipulate the spine, you create better range of motion. It goes away over time. And so
Just creating space.
Yeah,
And making
creating
more
space.
flowing. Yeah.
like I went to school, and so I was adjusted basically 7 days a week for a few years
Wow.
while I was in school. But I like getting adjusted. For me, it works really, really well personally when I do it. And like I said, it really depends on the person. But most of the time for me, it's because I'm restoring range of motion. There are different approaches where they're specifically working on particular regions to address the nervous system. And that's a very oftentimes like specific kind of continuing ed that they'll do for that.
And when you're doing an adjustment,
Yeah.
like what is actually happening? You're moving the joint to a different position?
Not a different position, okay? Okay, joints don't move out of place. That's called a dislocation. But what we see is that it can't go in all the planes that it's supposed to.
Okay.
Right? And a joint is supposed to have a particular amount of like springiness. So if you were to take your finger and go to the end range, at the end of that, I should still be able to have
Yes.
a bounce. That's
Yes.
a healthy joint. Oftentimes when I can't get that, what's called joint play, then I'm like, oh, okay, this one needs to move.
Hypermobility, or
No.
what are you gonna look?
I'm
What are you?
I'm looking for something that's doesn't have that.
Doesn't move.
Yeah.
Okay.
So
Sorry.
you come down and be like, that's it, as far as I can go.
I see.
Versus it should have a little bit more.
And what are you thinking when that's happening?
Then I got to go and figure out, there's a lot of physics here, which is my favorite part. Where like, which vector, which direction is it not moving? Is it in rotation? Is it in flexion? Is it an extension? Depending on where you are in the body. And then be like, okay, how do I restore that movement? And then that's when you would kind of
You
apply the
decide
adjustment.
which direction to
Yeah.
put force.
So like if you're
into.
missing extension, that's how I would then use the adjustment and the technique. And there's particular angles that you want to use. If you're going to get super technical and into it. Yeah.
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 Wow.
That's fun.
So when you're doing a spinal adjustment
Yeah, yeah.
specifically, let's say someone's on their stomach and you're like,
Impressed.
you know those videos that you see?
Yeah. And then you hear,
What is happening there?
ooh, in those videos? Well,
Like, why is that? What is the crack? Like, what is that sound?
so that's our understanding of it as it is right now is within the joints, we have synovial fluid. Synovial fluid apparently sometimes creates some type of like gas, even though there's no actual gas in there. And that's kind of what we describe as being released. through
Like
the
a glow
joint.
stick.
Yeah. Right?
Yeah.
Kind of like there's technically not, there shouldn't be any gas in there, but like for some reason it makes that noise. So the change in whatever is in there creates enough pressure to create a noise. Not everybody actually cracks, by the way. Not everybody makes that noise when you adjust them. It's silent. Or sometimes they'll be like, oh my God, you hear that? And you're like, I heard nothing. That was all internal. It's called bone conduction. So you can hear it like, yeah.
That's so cool.
So some people hear noises and they're like, oh, I don't hear a thing. And part of it is just
Okay.
because it, similar to like tapping on the table.
Yeah,
You
yeah,
don't
yeah,
hear
yeah,
it,
yeah.
But you feel it,
Yes.
but your brain interprets it as a sound.
Right. Wow, that's so cool. First of all, so it's like the synovial fluid and air moving around, possibly.
Possibly. It's not well understood what makes the noise. I think that's the best description that we have
That's
out
so
there.
crazy too, right? So
Yeah.
it's like we don't even know. We don't
Yeah.
know. It's like
We're
are
not
moving.
sure.
Like we are moving through a hallway with a candle, and we're
Yeah.
just trying to find our way. And
But part
that's
of
the industry.
the reason is how are you going to test and figure that out?
Yeah.
Right? Most of the time we've done this on the gross part cadavers, but you're not allowed to go and poke and prod somebody's joint when they're alive.
Yeah.
Right? There's ethics regarding that. I mean, I'm sure in certain countries you can, but like they're still not,
Yeah. There's limits.
as far as I know. I haven't gone and researched this in a while, but we don't have a true understanding of why it makes a noise.
Yeah. Wow. Fascinating. Okay, I want to play our game.
Yeah.
We're gonna do some kiss, Mary, kill.
Oh boy.
I'm gonna pull them up.
Okay. I'm ready, I think.
You're
I don't know.
ready?
Maybe.
Born ready. Born ready, baby. Okay, we're doing. Oh, I'm so excited. Okay, so for like desk and posture mods, standing desks, ergonomic chairs, like those fancy ones, and you can talk about these, and posture braces.
Oh,
I can't wait to talk
okay.
about this
We're
one.
killing
This
the
is like
posture brace. Please.
Thank you.
Please. The posture brace is a passive modality. It will
Yeah.
never support your posture. Now, it can have temporary benefits. It can make you feel a little bit better.
Yeah.
Okay. Yes, temporarily. You still need to do the work to work through your posture, which is mostly all about range of motion.
Yeah. Yeah.
I mean, kill the posture brace. At least from my
Kill posture
perspective.
brace?
I might have people out there arguing with me, but that's okay.
Oh, I hope not. Ergonomic chair or standing desk. So you got to marry one of them.
So those are tough because I'm really not tied to either. I'm not committed.
No.
But let's try here. So I think I'll go with. I'm gonna kiss the standing desk.
Really?
And I'm gonna marry the chair. Part of the reason that most of the time people with a sit to stand desk don't use it appropriately. So what I've seen is they either don't move enough, they don't set it up appropriately, and then even though they're standing, which is better for them, they don't have the right setup while they're working. Like everything else doesn't get modified.
True, right. 'Cause
Yeah.
it doesn't move. You'd have to have
Exactly.
a desk and a screen that moves
Yes,
too.
because you have to be
the
able.
screen,
It's going to
yes.
change. And the other thing that happens is people get so excited about it that instead of slowly integrating the standing by like, oh, today I'm going to stand for 15 minutes in the morning and then 15 minutes in the afternoon, they go from sitting 8 hours a day to standing 8 hours a day, and the next thing you know, it's a whole other. Oh my God, I'm lying on my back hurts issue.
Yes,
So
100%.
I will kiss the standing desk.
Okay.
I'll marry the ergo chair. Now, the reason behind it is typically when you get an ergo chair, you'll get an ergonomic assessment so that the chair fits. If it's a well-fitted chair, the arms are in the right place, the screen and the keyboard are in the right place, you'll be well set up to actually do your work.
Yeah.
And then it's a lot easier to say, hey, just stand up. Like set yourself a reminder. It pings you like a meeting notice every 45 minutes. You get up. All you need is 30 seconds to walk around your chair and you've
Yeah.
already changed your posture.
100%.
That's it.
Yep. Do you know about the like screen height? Because I have heard that it should be at the eye line, like the top of the screen should be at the eye line, compared to like looking up or looking down especially, or looking to one side, especially like people with neck pain.
Yeah.
Like, I always say like, okay, like where do you sit with your desk, or like how often are you looking at screens? Are you taking breaks from looking away at the screen?
Yeah.
Neck pain, posture issues in general.
Yep.
Do you know anything about like the screen placement?
So I do a little bit, but because I work with somebody who does ergonomics all the time,
Okay.
I'm lucky enough I get
Sort
to
of like, hey.
defer
Yeah.
to some of that. But yeah, you just want to make sure that like when you're looking at your screen, you're not either doing a lot of this or doing a lot of that.
Yeah.
So
Okay.
it does play a little bit.
Makes sense. And for
But
people who
again,
are just listening, she did she looked all the way up or
looked all the way down.
So the eye line should be pretty neutral.
Neutral. Yeah.
Okay, that was a great answer. Okay, mobility and recovery tools, foam roller, lacrosse ball.
Is this still kiss, marry, kill?
Yes, yes, yes.
All right, foam roller, crossball.
And massage gun.
Okay, they all serve a wonderful purpose.
They're all very similar.
They're very similar. They are very similar. The purpose is the same in a way.
Honestly, I'm killing massage gun.
I'm killing massage gun too.
Yeah?
Okay, the reason I'm killing massage gun is most of the time it's not used appropriately. Massage guns have a vibration component, which vibration shuts down the nervous system. So more often than not, people dig in like way too deep and then they'll go do something and then it's actually feeling worse post.
Yeah, because they relax those muscles too much, and then
much.
they go and excite
Yeah.
them.
Yeah.
And they're not,
And
it's not prepared.
It's not
The
prepared.
tissues aren't prepared.
So I have people who try to use that as part of their warm up to loosen things up, and I'm like, please don't, please don't.
Yeah.
Especially if your warm up's not good, and like, no,
Yeah,
don't do that. So I'll kill the massage gun. No, it has its place, but for this experiment or process, we're gonna kill the
Yeah.
massage gun. I'm going to kiss the lacrosse ball, and I will marry the foam roller.
Really? I'm going the opposite.
Because I can use a foam roller for breathing exercises.
Oh. Good point. Okay, touche.
So yeah, and this is where I'm gonna vary. So the lacrosse ball, I love. It's great going into trigger points.
Yeah.
Sometimes it's a little too intense. People go on the floor and do certain things, and then you'll have the same effect. We're kind of pressing a little too much, going beyond because there's like layers of tissue, right? And lacrosse ball is really hard, and so you'll get into some good ones, but sometimes you're going to go too far and get into some that don't really need to be released, and then sometimes it'll make you feel uncomfortable. But
Okay.
fantastic tool. Love the lacrosse ball. Has its place. The foam roller, I have a personal hatred with the foam roller. Me and the foam roller, when I foam roll, it hurts so much all the time.
It hurts.
But I love using it for other things, like being able to do breath work and taking away compression in through the pelvis, rib cage, forcing air into particular directions. And then after that, you can get the complement of understanding how to roll the tissue.
Okay, you've
I would've-
converted me.
I w-
That's a great point.
I thought I would have gone in the other direction, but thinking about the
No.
breath work that we talked about,
It's
that
true.
makes sense.
You're actually so right. The thing is, I usually use yoga blocks for that stuff. Or a gorgeous ball. So I don't
Yeah,
really
yeah.
think about it that. But
You
gotta
could.
try the foam roller.
Yeah.
So you can like sort of like lay and get
I call
the
it the
air in the
banana.
ribs. Yeah.
You kind of
That's a great way to put it. Yeah, that's so funny. Okay, spinal care approaches. I don't even know what this is, but you probably do. Chiropractic adjustments,
yes.
yoga for spine health, sure, and inversion tables. What's an inversion table?
An inversion table is basically where you strap your feet on this plank and then you flip yourself upside down. And then it goes. And like basically, yeah, because you're upside down, it decompresses your spine.
Oh,
Yeah.
which is good.
Yeah. I mean,
Can be for some people.
Can be for some people.
Yeah.
It's just, it is also temporary. It is just like the brace. So I'm going to kill the inversion table because it has the same effect as a brace. It's passive. But if you're in that acute phase and you tolerate it and it helps so then you can get movement after,
True.
then it has a place.
Good point.
But if you're just like, oh, this is how I fix my back, not so much.
I gotta get back on the inversion table.
And this is where I apologize to my colleagues. I'm going to kiss the adjustment, but I'm going to marry the yoga.
Marry the yoga. Okay.
It's more active. A spinal adjustment is passive. It's me
Yeah.
doing the work for you.
True.
And so it serves a place at creating range of motion, and then we got to support the adjustment by giving you the right homework.
Yeah.
Versus the yoga is its own home. They would go together. Do you know what I mean? It'd be like,
Yeah.
I would do that, and then I'd tell you to go do the yoga to maintain it.
Yeah. True.
That's how I would go about
Move,
it.
keep it
yeah,
moving.
keep it moving.
Okay. Sleep and alignment aids. I guess these are all kind of the same and probably good for different people at different times.
Yep.
But memory foam pillow, body pillows, or like pregnancy pillows, And orthopedic neck pillows.
No, you're killing me here. All of those are actually really good.
Okay.
I'm Mary all of
The
them.
suspense. I'm surprised about the memory foam pillow. I thought you would say that it's too, like, it has too much
Depends.
give.
Depends on the pillow. There are some memory foams that are actually really stiff and they don't have that much give.
True.
So I guess it would depend on the memory foam. If it is one of the soft, cheap memory foams, you pay $20 for it, kill that. Put it in the trash right now.
Take it out back like old Yeller.
Yeah, exactly. What a sad movie. But anyway,
Very.
as far as the body pillow, if you are a side sleeper, I highly recommend it. It does keep kind of nice alignment. And then orthopedic pillows, it depends again on the type of sleeper you are to get the right one. So
Yeah.
I guess I would marry the body pillow for a side
too.
sleeper. And then I would probably kiss the orthopedic pillow, cervical pillow, depending on who you are.
Okay.
The memory foam, it's going to depend on again, if it's a good quality memory foam or not.
Yeah.
So
Makes sense.
yeah, because I got a Tempur-Pedic memory foam pillow, and for a while it was like the best thing ever. But like,
Yeah, and then it, like,
yes,
wears out over time.
yeah. Well, the other thing is like I beat up my pillows. Like I turn around like this when I sleep. So my poor
flippy
pillows
floppy?
have yes. So anybody out there who thinks that stomach sleeping is bad and they come in, they're a little embarrassed about being stomach sleepers. It happens. It's really hard to change a habit when you're awake. It's even
so
harder to
hard,
change a
especially
habit
if
when
that's
you're
the way
asleep.
that you sleep. Like, oh my god. My god. No one wants to affect their sleep.
No.
Okay.
Yeah.
I'm very excited for this one.
Okay.
Okay.
I'm ready.
Barefoot minimalist shoes.
Yeah.
Orthotics. And then we'll go like Hokas. Obviously depends on the person.
Depends on the person. Depends on the foot.
I already know what my answer is, I think.
Yeah.
You go first though. I don't want
I
to
have to go
invent your
first.
answers. Yeah, you have to go first. Snap judgment. Go.
Okay, this one's really, really hard.
Really?
Yeah, it's really hard for me. You like gave me the hardest thing ever in my mind, being the foot person that
The
I
foot
am,
person that you are, that's true.
because I have literally put a person in each of those things because that's what they needed. And so I would probably marry, same thing, all of them, because it depends on the foot that I'm seeing. I will say, just based on a couple things, I haven't put as many people in a true barefoot shoe as often. So just based on that,
Okay.
I'll kill it. But I love it, okay? That
Agreed.
doesn't-
Kill barefoot
I mean,
shoes.
kill the barefoot
I have no
shoe.
problem killing it.
Yeah, okay, that's fair.
I'll tell you why after.
That fair. For me, it's just because I'm just gonna go based on my stats at work. The orthotic, I will kiss. The reason for that is, I don't know. Would I kiss that? You know what? On the pair that we sell, I'll marry my orthotic, and then I will kiss the Hoka, because the Hoka depends on the height of if
Yeah.
there's too much cushion.
Yeah, that's why.
Yeah.
I almost was gonna say killing Hoka, just because it's such a cloud that
I
people
know.
have no sense of the ground. They fly through the gate
Yeah.
cycle, and like if you're not a runner and you don't need that like sort of assistance to like fly, then it's just giving. I see so many people wearing Hokas day to day, and I'm like, I cringe. I don't know if you do. Depends on the
Depends on
person,
the
depends on the
foot.
foot. I know.
It
Maybe
depends
I'm
on
just
the
being too
foot.
black and white,
But
but
I mean, they look really chunky, and so it
They're
kind
so
of
chunky.
freaks people out for that. But I would say, yeah, it would flip depending on the day. So right now, I'd
Yeah.
probably go marry the orthotic, the pair that we sell at work. I really like, but I would like to remind everybody that sometimes an orthotic for some people will function as a brace, and they will be able to remove it at some point. Because
Yeah.
if we're doing the foot stuff that we're supposed to do in terms of exercises, oftentimes after a while they don't necessarily need them.
yeah. So it's like
If
a
we retrain their foot
dance.
properly, it's a dance. It's a
Yeah,
dance.
yeah.
Yeah. So it really
And
depends.
it gives it's so specific and molded to you.
Yeah.
So it gives your brain the information it needs to move the foot in that specific way.
Yeah.
So I do agree. I marry the orthotic and kill the barefoot shoes just because walking on flat surfaces all day. We're walking on pavement. We're walking on.
Some of the best runners in the world run barefoot all the time. They're the best. They literally
But are
wear
they
no
running?
shoes.
Are they running on pavement though?
They can. That's the kicker. They're not running like that all the time. They're not on pavement. They're on grass and on dirt most of the time. They have extremely flat feet. But like if you were to temporarily put them in that environment, they probably could do it. It would just be very uncomfortable because concrete and like asphalt has zero bounce back, unlike dirt. It's really hard, which is part of the problem. So like I think for barefoot shoes, mostly people don't transition into them properly. They go from wearing hokas to then wearing barefoot shoes, and like there's a transition period down to that. I think that's the part that's missing.
That's a good point.
Well, that was a tough one.
Okay.
Yeah.
Interesting. Frequent micro breaks from sitting, daily stretching routine, so sort of reactive, and walking meetings. It's kind of
Walking meetings.
Yeah,
That
like,
is random and arbitrary. Not many people do that. Most people don't have a walking desk. I'm going to kill the walking meeting, even though I kind of like it, but it never happens. So we'll just do that way.
kind of unrealistic.
Kind of unrealistic.
On Zoom.
We'll kiss the routine, the mobility routine.
Kiss the routine.
And then I will marry the micro breaks.
I do agree.
100%.
Yeah, that's good.
That one was easy.
Ooh.
Oh, no, not a hard one.
No. Okay, Epsom salt baths, dry needling, and cupping therapy.
Very different.
Modalities?
Yeah.
Yeah.
I'm like, what are they doing to me here? Okay. Also a hard one. I'll probably kiss the dry needling depending on the person.
Okay.
We're talking modalities. Now, you can't do dry needling and and cupping kind of. You can do some cupping on your own if you kind of know. Epsom salt baths are great because you can just do them on your own.
Yeah.
In terms of like what they'll do, you'll get more out of cupping and dry needling. So based on that, I'll kill the Epsom salt bath.
Okay.
I'll kiss the dry needling and I'll marry the cupping.
Marry the cupping.
But they all serve their own place. And they kind of have their, mostly because I really enjoy cupping. I can't tolerate it very well, but I enjoy it.
For people who don't know, what is cupping therapy?
Cupping therapy is when you take this tiny little, it depends the type of cupping, by the way. There's silicone cups, which is usually what us physiotherapists and chiros and stuff will do. If you're Chinese medicine, it's a glass cup with fire. It's a very different type of cupping style in terms of Chinese medicine. That feels fantastic, but also not fantastic. But basically what you do is you'll find spots of tissue that are really, really tight, and you'll create a suction in there, and the goal is to be able to glide the cup, kind of pulling the fascia and the tissue apart to kind of release it. Yes, it leaves those funky bruises that everybody saw in Michael Phelps and all those swimmers.
Those freaked me out the first time I saw that. I was like, what is that?
Really scary. I got some done on the back of my neck, and it was like completely purple, and I completely forgot. I went to an event with my hair up, and everybody was like, what happened to you?
Yeah, it's scary.
Nothing. Dry needling. So that's what cupping is. I hope that kind of clarified.
That makes
Great.
sense. Yeah.
Dry needling, that is like super intense. At least for me personally. Some people absolutely adore it. For them, it's the best thing. For me, I find it intense, but it makes a big difference in terms of the tissue. This is why I'm only gonna kiss it, mostly from personal being like, ow, that hurts, but feels good later.
Yeah.
Type of approach. Yeah.
Because it's like acupuncture, or is it different from acupuncture?
It's slightly different. So
because acupuncture
is Chinese medicine. Like true acupuncture is Chinese medicine. They use these meridians. I cannot explain it well, so I'm not going to go into greater detail. I can just say that, like, for some people it works. For me, it works. It works really well. Dry needling is much more focused on the muscle and
fascia,
tissue and the fascia.
Yeah,
now, they still kind of follow some of those chains and some of those meridians, if I understand correctly in their training. I don't do acupuncture. I solely focused on my chiropractic thing because I was like, I want to be excellent in one thing. I don't want to be good at multiple things. That was a personal preference for me. I've had a lot of people try to tell me to go and do it, and I was like, it's not for me. We have someone in the office who does it.
And there's so many other paths to go down that you could refine compared to, I get that. Whereas the acupuncture is more like, am I remembering this correctly, that it's like linked to organs and stuff?
Yeah.
That's part of the Chinese medicine?
The qi.
Meridians?
Yes.
Yeah, the qi, okay.
Yep.
Makes sense.
Yeah.
Makes sense. Okay.
Don't get me wrong, though. A good Epsom salt bath just
fire.
is fantastic.
Fire.
Especially post-workout after somebody makes you do split squats and Nordic curls.
Yeah. Damn you, bat. Okay, lumbar support cushion for the car,
Yeah.
adjusting steering wheel and seat position, car headrest modifications. This is our last one.
Okay. Yes. Okay. Headrest. None of these cars are designed properly anyway.
Really?
Oh no.
Ooh, this is a good
So
red pill.
just so you know, I am only 5 feet tall. Not a single car seat is designed for me, and if I get into a car accident, it's not good for me at all
Yeah.
because I get the seat belt right in my neck. The headrest also pushes me forward, so there is no true space. So
Do you take the headrest off?
no, I leave it because you have to. If not, it's even worse for whiplash. And most people actually have it too low. It is supposed to be actually quite high, so it can kind of get you there. You kind of have to do all those things. Like the lumbar support is really important in terms of long rides because most people will fall into this posterior tilt, which actually puts a little bit more pressure in through your discs. The steering wheel is also important because if you can't reach from, you can't really maneuver. And then the headrest is important in case you get into an accident, but uncomfortable.
Okay, you don't have to do the game for this one.
I was going to say, like, this is safety, people. Safety. Can't get rid of any of them.
That's so funny. Okay, well that makes sense. Is there something that people? Is there like a rule that you know where it's like okay, like an elbow's length or something, or
For the steering? I
yeah,
want to have a slight bend to the elbow.
Slight bend,
You
lax.
don't necessarily want to be out here. Some of it comes down to preference. There is a whole like ergonomics to cars as well. But
you
I've
would
never done it.
cringe if you saw the way that I drive.
Guess what we're doing after this? No, I'm just kidding.
It's insane and completely unsafe, but it's so comfy.
It's okay. I used to drive really crooked. I drove a manual transmission car for years, and I'm short, so I was always crooked.
Yeah.
So then I would drive from here to my school, which was down in the States. And next thing you knew, I would always book an appointment in the student clinic on Monday morning from coming back from a trip to Ottawa and be like, you guys need to fix me because I'm all rotated.
No, actually, right? No, it's so true. I switch it up a lot.
Yeah.
I like to make sure because I can really feel myself just sort of sinking into the same old pattern every time.
Yeah.
Yeah. Okay.
Yes.
Well, that was so fun and went by so fast. I'm so surprised.
I'm sure you have more questions. We'll have to just do it again.
Yeah, we will.
Yeah.
That's okay. Thank you so much for coming.
It was
out.
my pleasure. I had a lot of
It was
fun.
so fun. Yeah.
Nice.
Okay. Ciao, everybody. Thank you so much for listening and watching. This is our last season, or last episode for the first season. We'll probably be back in November, but I'll see you then. Ciao.